I am Dr. Eleanor Glenday, consultant paediatrician at Worthing Hospital. I'm talking to you about holistic care in paediatrics. For me, holistic care involves looking at the whole child, not just focusing on the medical condition or diagnosis that they have, but also thinking about the mind and body and how that interacts in them and in how their care is delivered. It springs to mind that that you have to be much less narrow in your approach, and you have to go much more in depth with the child. You have to, for instance, take time to get to know the child and their family and all the interactions that ensues. Sometimes that involves going to see a child on more than one instance during their hospital mission. A recent patient that I had of mine was attending hospital on numerous occasions with severe exacerbations of their asthma and wheeze, one of which actually required retrieval and intubation and transfer to a tertiary centre. It was only really when talking to the family and the child in more depth on their return from tertiary input that we realised that this child was having a lot of difficulties at home. They were acting as a young carer, and they were struggling to balance their very severe asthma with their day-to-day chores and help at home and their school. So it wasn't just a case of the child and the family not treating the asthma appropriately and not getting the treatment in effectively and quickly. It was also, there was an interaction between how the child was coping with their whole situation and also with their illness. And I think this demonstrates very clearly how holistic care is important in paediatrics.